If you're still on your parents' insurance and you're going to be turning 26, what time periods do you need to keep in mind? Because by turning 26, you can no longer be on your parents' health insurance if you still are. Well, it depends on how your parents are getting their health insurance. If they're getting their health insurance through the healthcare marketplace, the healthcare.gov, the Affordable Care Act, the Obamacare plans, however you want to call it, you have until the end of the year to make a change. Even if, for instance, you turn 26 in February, you don't have to make a change until the following January. So when November 1st rolls around and it's the open enrollment for healthcare.gov, you want to make sure you enroll in a plan for January 1st because you will be dropped on December 31st. But if your parents are getting it through an employer plan, you're able to stay on that plan until the end of the month you turn 26. So if February you turn 26, you're going to lose that employer coverage to your parents at the end of February. And then from there, you have 60 days to enroll in coverage during a special enrollment period. Even though it's in the middle of the year, you're able to make a change, enroll in healthcare.gov, enroll in the employer plan that perhaps you can get through your own employer, and get enrolled in coverage. Now you can plan this ahead of time, so there is no gaps in coverage, but it's important to keep those two time periods in mind. So when you're turning 26, it depends on how your parents are getting their health insurance, on when you need to make that step and make that change. If you don't do anything, you could leave yourself uninsured, which is a big risk that you'd be taking. So make sure you're well informed, make sure you're educated, and decide on a selection, whether it's through private insurance, through healthcare.gov, or through an employer plan, on making sure that you continue your health insurance after you turn 26.